Rachel. I'm going to be your nurse today. What is your name?
Garrison.
And how old are you?
22.
Okay, Garrison, today you're in for an abdominal assessment. I'm going to be touching a lot of different spots and listening to several spots on your abdomen. It doesn't mean anything's wrong. We're just doing a really thorough abdominal assessment. If you have any tenderness during the assessment, just let me know, okay?
Okay.
I'm going to go ahead and lift your shirt up, and I'm just going to start off by getting eye level and looking at your, I'm inspecting, I'm looking at the contour and the shape. I'm looking at any scars, striae. I don't see any peristalsis or pulsations. I'm going to go ahead and listen to your bowel sounds. And I'm listening with the diaphragm of my stethoscope. There's bowel sounds in all 4 quadrants. I'm going to go ahead and switch my stethoscope to the bell side and listen to vascular sounds. The aorta, left renal artery, right renal artery, right iliac artery, left iliac artery, femoral artery, right femoral artery. Okay, now I'm going to do some percussion, just meaning I'm tapping on some spots. Okay, I'm going to do some light palpation. Any tenderness?
No.
Here?
No.
Any tenderness here?
No.
I'm going to go a little bit deeper. Any tenderness?
No.
Here?
No.
Here?
Nope.
Alright, now I'm going to go ahead and check for some organ swelling. If you'll take a deep breath, I'm going to go ahead and check for the liver under your rib cage. Any tenderness?
No.
Okay, I'm going to do a spleen. I'm going to lift you up just a little bit. Take a deep breath. Any tenderness? Okay, now I'm checking the kidneys. Alright, that's good there. Good there. Now I'm going to do some specialty tests. First, I'm checking for the gallbladder. It is called the Murphy's test. Take a deep breath again. Any pain or tenderness? Okay, and now I'm going to do the McBurney's point. Any pain when I push in? When I take it out?
No.
And now I'm checking for rebound pain, and this is the Bloomberg's test. Any pain when I push in? When I take it out?
No.
Okay, both the McBurney's point and the Bloomberg was checking for appendicitis, and I'm now going to do the iliopsoas test, which is also for appendicitis. Try to lift your leg. Any pain?
No.
And what about this leg? Any pain?
No.
Okay, you're negative for the iliopsoas. If you'll just sit up and turn that way. Okay, and now we're going to check for CDA tenderness, which is kidney tenderness. Any pain?
No.
Any pain here?
No.
Alright, that concludes your abdominal assessment. Thank you.
Thank you.
Report on a 22-year-old male who came in just for an abdominal assessment. I started out, I inspected his abdomen, which was nice and flat. His color was appropriate. It was symmetrical. There were no scars, striae, and his umbilicus was nice and midline. There was no visible peristalsis and no visible pulsations. I then moved on and I listened to his bowel sounds. He had bowel sounds in all 4 quadrants. After I listened to his bowel sounds, I was listening with the diaphragm for those. I then turned it to the bell side and I listened to his vascular sounds, which was aortic, renal, iliac, and femoral. They were all noted with no thrills. After I listened to his vascular sounds, I then moved on and did percussion with resonance and tympany noted, and he had no tenderness while I did that. After I did percussion, I did light and deep palpation. He was negative to tenderness during both. After I did my palpation, I checked for organ swelling. His liver, spleen, and kidneys were non-palpable. There was no swelling noted, and he had no tenderness in any of them. After we checked for that, we then did specialty tests. He was negative for Murphy's test, McBurney's point, and he was negative for Bloomberg, and he was negative for iliopsoas as well. Finally, he was negative for CVA tenderness. And that concluded our abdominal assessment.